Yes. Wait. Professor Dr. Vitull K. Gupta. He is a consultant at Kishori Ram Hospital and Diabetes Care Center, Bhatinda. He is an avid health and human rights activist, a member and executive committee of Cardiological Society of India. He has multiple fellowships and a role of honor in table tennis, lawn tennis, badminton, and swimming. A dynamic person that he is the chairperson and organizing committee of multiple iterations of Epicon, the organizing secretary of Mapicon, Bhatinda, and multiple iterations. He has multiple papers to his name, several abstracts, guest lectures, and chairings. He is the chief editor of API ICP monograph on COPD. He is the member of scientific committee of APICON 2016 and a member of JAPI DIPSI guidelines. He is also in the editorial advisory board of the Indian Heart Journal. Welcome, Professor Dr. Vitull, and let us start with the session.
Yeah, thank you so much. So where do I share the slides? Yes. Thank you very much for the kind words, and I must congratulate Dr. Neeraj Nagpal for including this rather important topic, that is challenges in medical education and communication skills. So my dear friends, as India marches towards a bright future of growth and progress, medical education is expected to play a pivotal role in crafting a sustained development agenda. The idea of creating a healthy society is no longer a debatable luxury. Its significance has been grasped by policy shapers worldwide, especially in the post-COVID era. So after the COVID, I think all the health planners have realized the importance of health and more efficiently the public health and preventive health in the present era. In a developing nation like India, medical services play a very important role in well-being of their citizens and indirectly play a very important part in economic and overall development of the nation. We all know millions of people are pushed below poverty line because of extensive extra pocket expenses in India. So medical education in India is at crossroads and maybe on the verge of collapse. Mind you, this is a very strong statement, and a few people may not be with me on this because they don't know the ground realities, what I feel personally. Following factors contribute to a gloomy picture, and each factor is a subject of lecture in itself. So we can debate on each of the following factors for days together to know the challenges faced by medical education. First and foremost is exploding number of private medical colleges. If we go by the history, after independence, there were more public or government hospital medical colleges rather than the private. Now the private medical colleges outnumber the government medical colleges, which is having a skewed distribution around the country. A few states have large chunk and a few states have very less, and they are concentrated more in the urban areas rather than remote areas or rural areas. Devaluation of merit in admissions, particularly in private institutions, even after NEET. When NEET was introduced, we thought it is a revolutionary step to decrease the capitation fee, but it proved to be other way around. Now there are many reports, newspaper reports, which say merit takes a hit. The percentile cutoff introduced for NEET lowered the mark bar, became counterproductive. Several non-meritorious students found themselves eligible for admissions. Deep pockets with poor scores eventually paid their way into private medical colleges. What happened before NEET? It was capitation fee, which used to be by the rich students to get admission. Now the NEET, the cutoff marks are decreased Even so, the rich students are getting admissions. Some MBBS student got 0 or less in NEET paper. This is exposure of ineffectivity of NEET to uphold the merit. Increase in fee making medical education out of reach of poor or even middle class students. So what happened before? The capitation fee was there. Now the medical colleges have increased their fee to match the capitation fee, and even the government colleges are increasing their fee because of the various reasons. So we have been like PG seats auctioned for 3 to 4 crores. So there, even after introduction of NEET, we find reports that still PG seats are being auctioned at a very high premium. So we have been fighting on this to decrease the medical education fee, whether it is private or it is government. So admission of suboptimal quality of students with poor motivation is a great concern. A less than desirable evaluation system, and many private colleges have contract to pass all the students in private medical colleges. And you can see the standard of the students, splenomegaly of the liver, and there are so many things, intraesophageal echocardiography, and there are number of cases where the final year students have known angina pectoris is a disease. It is a kind of disease while the patient suffers from angina, or chronic stable angina is angina pectoris. It is after severe burns, or atrial fibrillation is fibrillation of arteries and veins. So this is a final year student appearing in exam, seeing the blood pressure. You can see the suboptimal quality of doctors we are producing. An alarming shortage of teachers, giving increased ghost faculties who are in private medical colleges. They are aware of such a presence, and not all, but majority of the colleges go for ghost faculties. And there is gross shortage of patient in most private institutions to fill the MCI requirements with rented patients. And you can see these patients sitting like picnic, and there is no medicine or files, and there are scores of ghost files being made for the medical patients. Poor internship learning and training because of entrance test for PG. So this is the most dangerous part, because the students now, they don't learn the clinical things in their internship because they have to prepare for their PG test. So the internship period is gone, and they are not used for learning the clinical things. Outdated curriculum, insensitivity to the society's requirement, neglected research and lack of faculty development program, corruption and unethical environment is the main challenges which are being faced by the medical education today. So like Adesh Institute was de-notified for charging money for insured patient, and still they are promoting ethical practices and empanelment to the Ayushman Bharat scheme. Medical education is the most neglected subject. Serious thought has to be given to desirability of replacing one unsatisfactory and inefficient MCI with another more powerful but equally non-accountable bureaucratic system of NMC. So NMC has yet to prove his credentials, whether they are going to go like MCI or they are going to prove themselves. There is no separate budget for medical education, and it is part of the health budget. It is likely that government funding in medical education will be further curtailed in future, affecting the public medical education. Private colleges will be allowed to flourish and make profits. That is what NMC is thinking of. And in the recent budget, you have all read big push for healthcare and infrastructure, and it was touted that it is 137% hike in outlay of healthcare. But in reality, it was only 10.5%. Previously, it was 67,000 crores. Now it is 75,000 crores. And government is just hypocritically announcing that they have increased so much, and overall education budget has decreased if you go by the previous budgets. So that is what the government is thinking of. What is required is comprehensive consideration of issues plaguing medical education to evolve solutions that may take care of the root of the problem and solutions which can be implemented in short, intermediate, long term to restore medical education to pinnacle it has once reached. When we were students, medical education was thought to be very good and it was up to the mark, training the students for clinical practice as well as the requirement of the society. So we need to have short term, which could be implemented in 1 year or 2 years, intermediate and long term policies to revitalize the medical education. It is surprising that no shrill voice of protest and professional organizations are conspicuous by their unawareness or lack of interest in the problem. So that is why medical education is never discussed because of the vested interests. And I must congratulate Dr. Nagpal to introduce the subject so that we are sensitive to the requirements of medical education. The question needs to be asked by all: who will apply the brakes? Is there still time to stop and reverse? And more importantly, is there a political will to do so? But in my personal view, I don't find any change. Rather, it is going to deteriorate over the years if we inspect the past, what has happened to the medical education. So now coming on to the communication skills, which has gained importance in about last decade. Practice of medicine was easier earlier because patients had a lot of faith in the profession to the extent that they compared doctors with gods. In good golden days, medical students used to imbibe basic communication skills conspicuous or subconsciously by observing their peers or senior colleagues and teachers. Fortunately, almost all teachers were good role models and demonstrated empathy, compassion, and communication skills in their work. Though not explicitly taught, the message from part of the hidden curriculum which influence students' development as their physicians. With changing times, medical profession and medical education has gone a drastic change under the hypnotizing influence of commercialization and greed for money. Previously, all the students used to look to their teachers to learn ethics, and it was part of the hidden curriculum. Nothing was taught as such, but seeing their senior teachers, senior colleagues, seniors, it was a hidden, you can say the open and hidden curriculum that all were following the ethical practices. Now, professional ethics are compromised for business ethics. So it is a altogether a new chapter that whether professional ethics are more important or business ethics are more important. Doctor patient relationship, which was based on empathy and trust, has undergone a drastic change that has led to mistrust, dissatisfaction, and aggressive reactions. And we all see, especially exposed in COVID era, how the doctors, nurses, or paramedical staff was treated in COVID. In view of the changing circumstances of healthcare scenario and medical education, it is important to work on our communication skills. Doctors and healthcare providers need to be proactively meet the communication needs of the patients and their family. This will not only ensure accuracy of diagnosis, treatment, patient safety, and continuity of care, but will also create greater patient satisfaction. So, in modern times, good doctor patient communication is central to the therapeutics, relationship, and patient satisfaction. Today, it is felt that medical education curriculum in India focuses on clinical skills and does not address the communications, interpersonal skills, and management skills. The lack of communication skills, training, and inability of people to communicate effectively cause a large amount of stress, frustration, anger, resentment, misunderstanding, and disappointment, leading to increased distrust in patient doctor relationship. MCI has taken initiative to include communication training for medical students in the form of attitude and communication module that was introduced in medical colleges all across the country. But the next important challenge is to change the students' attitude towards medical education, healthcare, and society at large for effective communication, which I feel is the most important challenge, because if one student has paid 1 crore for PG and is taught in unethical environment, to change his attitude, to have a sympathetic attitude towards society, is a real difficult task. So, my dear friends, thought for the day is medical education should aim to progress by training compassionate, professionally excellent, and ethical, sound individuals who will go out as leaders of health teams and healing communities. So, now the doctors have to have a leadership role like they have proved in COVID era. Their services may be preventive, curative, rehabilitative, palliative aspect of healthcare in education and research. College must be able to provide a glimpses of all these aspects to students. To promote innovation and to meet the global standards in medical education, India needs to substantially rethink and reevaluate all the aspects of its programs and challenges faced by medical education today. Without keeping in mind the challenges, we cannot, or the policymakers cannot improve medical education. And this can only be achieved by a concerted, combined effort between all those involved in medical education, and most importantly, the political will. So, this is of prime importance. That is why I have underlined, without political will, we can debate so many things, still, it will be insufficient. Innovation should also target to develop communication skill and public dealing, because we don't have much of role models now. So we need a concerted curriculum for communication skills. A strong strategic approach will ensure a solid foundation for the improvement in health status of India. And mind you, if we don't improve medical education, we are unable to improve the health status of India. Medical education should be integrated, problem based, and evidence based. Medical education should find a prime place in our country's development. Nobody has right to commodify it. So if we are going to commercialize, excessively commercialize medical education, we are going to fail the health services in India. So there is always a debate that private and public, but India needs to have a policy which is in between, so that we don't confuse doctors among the professional ethics or business ethics. So we need to innovate and have a system of medical education which is unique to India. We cannot simulate somebody else's medical education system. So destroying a nation, you can destroy education system, but destroying medical education is going to destroy a nation's healthcare system. So if we are going to build nation's healthcare system, we need to focus on medical education. So my dear friends, I invite you all to Mapicon Bathinda 2021, which will be organized for 4 days from 16 to 19 September. And we have applied for 16 credit hours for Punjab Medical Council. Thank you, Dr. Neeraj,